that's going to be a short session again on patient experience measurement. So I totally agree that we need to work on building capacity to make improvement. So that's a must do. But we also need to, thank you, to work on facilitating the feedback and the follow-up. And so I'm just going to talk to you a little bit about what we're about to embark on. And it's okay. So just to let you know about our current procedure when we send surveys, okay? So our process with using HCAS, or the Canadian Patient Experience Survey that we use, okay, we send it by mail, okay? We send it every month. We're quite proud of that also, you know, it's every month. And we send it to patient discharge within like post 48 hours to 6 weeks. We send a second questionnaire to those who didn't answer after 21 days when we send the questionnaire. And then after another 42 days, if they haven't answered, we close the survey, okay? So can you imagine the time it takes to feed back the data to the teams that want to do improvement? You know, and that's the standard. We respect that standard procedure by CAPS, okay? That's the exact procedure that we do. And we randomize, we're quite proud, you know, we're randomized and everything. So, you know, it takes time, okay? So we clearly need to decrease the time required to provide the feedback to frontline teams because, like I said, like the frontline managers and the staff responsible, the physician staff responsible for the unit are key person in driving the improvement, and they need to have the data. And sometimes there's 4 weeks rotation, so now you might have done 2 rotations before you get the feedback back. So it doesn't make any sense. It is useful though. We need to do it because it allows us to benchmark ourselves and say how good we are. Okay, it is required, but we need different mechanism for providing fast feedback to the teams, and we also need methods that it's going to take less effort in terms of human resources to do those things, to support that improvement. So part of the answer is going electronic, okay? So we need to tap in these resources. Like, I don't understand why my car dealer is doing it and we're not doing it, okay? It seems so simple, but I don't know why when it comes to healthcare, it becomes complex, okay? And here, at like big academic centers, we all have those like huge databases. We can use these data, okay, to decide to whom we want to send surveys. And because it's electronic, we can send it to a lot more patients. And we can send back the results directly to those who need the data, okay? It seems simple to say, but I know we're not there yet. One of the challenges is capturing the email address of patients in our databases. So we're past that because of Frédéric de Civita, who agreed to work with us on this. But we need the collaboration of people that know, ask whether the information is up to date. You know, is your address up to date? Can you give us your email address? You know, do you agree for this? Asking for consent. So we're past that, okay? And these will allow us to create cohorts it's gonna allow us to create cohorts of. You want to focus on oncology. You want special diagnostic. You want to select. You can do it, okay? Because we have the data infrastructure to do it. You want to do it 48 hours after they visited the emerge. You want to send back the results to the patient of the survey. Here are what the other patients have said about this. You know, it's simple. It's there. The technology exists. We just have to do it and test it. So, and that's really what we're going to be embarking on. We selected 2 units, 2 groups that agreed to work with us and testing this approach. So we're going to be piloting this in 2 units. We're going to evaluate the outcomes. Okay, I'm sure we're going to be learning things along the way. And hopefully we're going to be able to provide recommendations to our own organizations. So if there's anybody in the audience, I'm sure I can learn a lot from you. But if there's anybody else that's is thinking about doing this, please contact me, and and let's work together in making this happen and learn together on how to do it. Thank you.